So now we're going to go over the general physical examination, sort of a head to toe. And before you ever start the examination, you can learn a lot from just watching the animal move. And one of the advantages of being a senior student is that you're going to greet the client up in the lobby, you're going to get a body weight, you're going to walk them back to the examination room, and you're going to get a chance to evaluate their gait and their posture and their demeanor before you ever lay your hands on the animal. And that's very valuable. You'll learn quickly that there's differences in gait from breed to breed, and so knowing the variation is helpful. You can detect some things better from a distance than you can from up close. So asymmetries like muscle atrophy is sometimes easier to see from a distance on an animal than it is when you're right up close. So you see the forest instead of the trees. And so you need to, but in order to be able to do that, you need to be paying attention as you're walking the animal through the hospital, and looking from a distance. In addition to asymmetries, you can also get an assessment of respiratory character as they move, and get an assessment of whether there's increased effort on inspiration or exhalation. And again, some of those things are easier to see when you're farther away from the patient. So you want to use all of your senses to try and focus on those behaviors before you ever lay your hands on the animal.